Our roadmap to cover hypospadias will include congenital anomaly, anatomy and classification of the severity of the hypospadias, genetics, environment and root causes, pre-surgical planning, surgical reconstruction, and finally the post-op realities. The first heading, the congenital anomaly. It is a common condition with an incidence of 1 in 250. Galen coined the Greek term hypospadiasis. It is abnormal ventral opening of the urethral meatus arising from the arrested development. Anatomy and severity. The anomaly can be classified into mild, moderate, and severe forms. The anterior is the mildest, with its location on the coronal end, which is very close to the natural opening. The middle in the midshaft accounts to moderate severity. The posterior, the scrotal type, is the most severe. The perineal is still more severe form of the anomaly. The severe clinical manifestation of the condition is CORDY, which is downward bending of the penis. Culp method of assessment says that the underdevelopment or hypoplasia of the corpus spongiosum surrounding the urethra is absolutely the most critical parameter. Coming to genetics and the root causes, environmental causes play a primary role, the plastics, the pesticides. During 12 weeks of gestation, masculine development is driven by a highly delicate androgen pathway, and the pathway can be disrupted by the genetic component in 10 to 20% of the cases, and environmental drug impact, endocrine disrupts like plastics, detergents, pesticides all fight the estrogen and decrease the development of the corpus spongiosum. Pre-surgical planning. The male children develop general awareness by 18 months of age. So, to ensure best long-term psychosexual development, the surgery should be performed by 6 to 12 months of age. Circumcision is strictly contraindicated for this condition as foreskin is used as a high vascular building material. Surgical reconstruction, the art of repair. It involves 5 major steps. The first is the orthoplasty, in which CORDY correction is done. Urethroplasty, urethral repair is done. Meatoplasty, natural looking slit like meatus is created. Glandsplasty, conical glands cover is created. And the perpusoplasty, in which adequate skin cover is provided over the penis. Serge Duplay, father of hypospadiology, developed the methods of reconstruction of the urethra, and he utilized fine instruments and optic lenses with 2 to 3.5 times magnification for the reconstruction purpose. Post-op realities, long-term outcomes. Risk of post-op leaks occurs in 10 to 30% of the cases. There is development of urethra-cutaneous fistula, which is most common, and a surgical seal creating robust vascular barrier layers using healthy surrounding tissue is absolutely critical to keep 80 to 90% of the success rate intact. The rising incident rates are directly tied to modern environmental disruptors, plastics, chemicals, which we are surrounded by. I want to leave you with a proactive thought that would just treating the anatomical symptom suffice while we entirely ignore the systemic environmental cause. Thank you so much for exploring the topic with me.